Why do NIPT false results happen? Imagine getting a test result that says your baby might have a genetic condition, but later finding out it was not true. That can be confusing and stressful. Non-invasive prenatal testing, or NIPT, looks at tiny pieces of DNA floating in the pregnant person's blood to check for certain chromosomal issues. It's very accurate but not perfect. Sometimes, false results happen because of biological factors or how the test is done. One common reason is something called confined placental mosaicism. The test mainly examines DNA from the placenta, not directly from the baby. If the placenta has a chromosomal abnormality but the baby does not, the test might say there is a problem when there really isn't. This can lead to a false positive. Another reason is vanishing twin syndrome. If a woman was pregnant with twins but one embryo stopped developing early on, DNA from that embryo can stay in the blood. If that embryo had a chromosomal issue, it might cause the test to show a false positive for the surviving baby. Maternal DNA can also influence results. Sometimes, the mother's own cells have chromosomal abnormalities or health issues like uterine fibroids or even undiagnosed cancers. These can release abnormal DNA into the bloodstream and make the test seem positive when the fetus is healthy. Technical issues can also cause errors. Mistakes in how the blood sample is handled, processed, or analyzed can lead to incorrect results. While labs work hard to avoid these errors, they can still happen. Fetal DNA levels, called fetal fraction, are important too. If there isn't enough fetal DNA in the blood, especially early in pregnancy, or if the mother is very overweight, the test might miss an abnormality. This can cause a false negative, meaning the test says everything is fine when it's not. Lastly, some genetic conditions are very rare. Because these conditions are so uncommon, even very accurate tests can sometimes give false positives. The chance of a positive test being wrong is higher when the condition is rare. Since NIPT is a screening test, not a diagnostic test, any positive result should be confirmed with more detailed tests like amniocentesis or chorionic villus sampling. These tests can give a definitive answer. It's always good to talk with your healthcare provider about what the results mean and what steps to take next. Knowing these reasons helps families understand that a false result doesn't mean something is definitely wrong, but it does mean follow-up testing is important.